Welcome to The Explainer. I am so glad you're joining us today. We're going to unpack something absolutely crucial, a set of policies that act as a literal safety net for the men and women who have served in the armed forces. We're diving into the Veteran Community Emergency and Crisis Care Guidelines. Look, navigating medical bureaucracy, it's stressful on a good day, but during an actual emergency, when every single second counts and panic starts setting in, it can be entirely overwhelming. You shouldn't have to worry about the cost when you're literally fighting for your health. So my goal today is to give you a really clear, calm, and structured map of exactly what the rules are, empowering you and your loved ones with this knowledge way before an emergency even strikes.
So picture this. What actually happens if a veteran has a medical emergency miles away from a VA facility? It's a pretty terrifying thought, right? You're out on a road trip, or maybe you just live in a rural community, and suddenly you or a loved one needs immediate help. The closest VA hospital is hours away. Do you risk the long drive? Do you just go to the local ER and risk mountain-sized medical debt? It's a super common and incredibly stressful dilemma. But as we're going to see in the source material today, there are very clear rules designed to protect veterans in exactly this kind of scenario.
Here's our roadmap for today's explainer. 1. General medical emergencies. 2. The 72-hour notification rule. 3. Suicidal crisis care. 4. Crisis care eligibility. And 5. Immediate lifelines.
All right, let's jump straight into Section 1, General Medical Emergencies.
If you're an eligible veteran and you believe you're having a physical medical emergency, you absolutely can go to a non-VA community emergency department. The VA may actually cover this expense, specifically when a VA facility or another federal facility they have an agreement with just cannot provide timely care because it's simply too far away. Or if the VA is unable to furnish the specific emergency services you need right then and there. The absolute priority is your health and getting you immediate, timely care, without the burden of trying to map out VA hospital locations while you're in severe distress.
Moving right along to Section 2, the 72-hour notification rule.
72. I really want this number etched into your memory. When a veteran is treated at a community emergency room, the clock literally starts ticking. The veteran, the representative, or even the community provider themselves must contact the closest VA medical facility within exactly 72 hours of the emergency. This is the crucial metric, the bridge between getting that immediate local care and avoiding financial ruin. Basically, the VA needs to know where you are so they can step in and handle the administrative side of the whole shebang.
The workflow here is pretty straightforward, but it's absolutely vital you know it. Step 1, you go to the community emergency department. Step 2, the local doctors work to stabilize your condition. Step 3, the VA is notified within that magical 72-hour window. And Step 4 is the transfer to a VA facility. Now, this handoff is an essential caveat in the guidelines. VA payment for that non-VA hospital usually ends the very moment a VA provider determines, based on sound medical judgment, of course, that the veteran is stable enough to be safely transferred to a VA medical center that can accept them.
So, how do you actually reach them? Here are the exact lifelines straight from the VA to make that notification happen. You can call 844-724-7842. Or you can submit a notification through the emergency care portal at emergencycarereporting.communitycare.va.gov/request. Seriously, keep these details saved in your phone or written down somewhere safe. They are the absolute logistical key to making that 72-hour rule work smoothly when time is of the essence.
Now, I need you to pay close attention here because there is a massive distinction depending on the type of emergency. For a general physical emergency, you have that 72-hour window to contact the VA. But if a veteran is facing an imminent risk of self-harm and goes to a non-VA emergency department, the primary directive completely shifts. In a suicidal crisis, the instruction is to tell the emergency staff that you are a veteran immediately upon arrival and ask them to contact the VA right away. The rules change because, well, the stakes are so incredibly immediate.
Which brings us to Section 3, Suicidal Crisis Care.
90 days. If a veteran goes to a non-VA emergency department for an imminent suicidal crisis, the VA may cover not just the cost of that immediate emergency room visit, but also the cost of their care for up to 90 days afterward. Just let that sink in for a second. Up to 90 days of covered subsequent care stemming from that single crisis visit. This is an incredible level of sustained support and ensures that a veteran has the actual time and resources needed to find stability completely without the crushing anxiety of medical bills hanging over their head.
Honestly, one of the most surprising facts I found in the entire source text is this.
A veteran does not even need to be actively enrolled in VA healthcare to be eligible for this crisis coverage. Yeah, you heard that right. The VA literally removes the barrier of enrollment to ensure that those at imminent risk of self-harm can get help and get it funded immediately. It is a profound commitment to saving lives first and asking the administrative questions later.
Let's dig into who qualifies in Section 4, Crisis Care Eligibility.
Okay, so while you don't need to be actively enrolled, there are some specific service criteria to unlock those 90 days of covered crisis care. To qualify, a veteran must not have a dishonorable discharge, and they only need to meet one of three requirements. First, if they were sexually assaulted, battered, or harassed while serving in the armed forces. Second, if they served on active duty for more than 24 months. Or third, if they served more than 100 days under a combat exclusion or in support of a contingency operation, and that includes serving as a member of the reserve. You literally only have to check one of these boxes to be eligible for this massive safety net.
Now, regarding that third point about a contingency operation, the guidelines include a very specific, modern definition. You meet this requirement if you serve directly in the operation or if you operated an unmanned aerial vehicle, a drone, from another location. The source explicitly recognizes that operating a drone from afar qualifies as combat support for the purpose of receiving this essential mental health crisis care. It's a really profound acknowledgement of the realities of modern service and the unique toll it can take on a person.
All right, our final stop, Section 5, Immediate Lifelines.
If you or a veteran you know needs immediate suicidal crisis help or just needs more information on eligibility and locations for care, the Veterans Crisis Line is standing by right now. You can call them, dial 988, then press 1. You can text a message to 838255. You can chat online at veteranscrisisline.net/chat or just visit their main website at veteranscrisisline.net. Please take a second to save these numbers right now and share them.
We have covered a lot of vital ground in this explainer today, from that strict 72-hour rule for physical emergencies to the incredible 90-day coverage for crisis care. These rules are there to protect our veterans, but a safety net is pretty much useless if no one knows where it hangs. So what does this all mean for you? Who in your life needs to hear this information today? Don't wait for a crisis to find out. Take care of each other out there, and thank you so much for joining us for this explainer.